Well, good afternoon, everyone, and welcome to today's edition of our Farm Quick Conversation series. As a reminder, these are just monthly Zoom lives, or Zoom and Facebook lives, where we bring on a guest speaker, a subject matter expert, to discuss different topics that are important to the farm program initiatives. As a reminder, also, the goal of these are really opportunities for interaction from our farm program participants, so our producers and our allied industry and our evaluators. So just a reminder for those folks who are interested, and we hope you are, in asking questions, you can send us questions in the chat box or in the Q&A box. If you're watching over on Facebook, you can just insert those into the chat in the comment section. And after I'm through with all of my questions, we'll turn it over to you guys to ask your questions. And so without further ado, we'll get started with today's conversation. I'm excited to be joined by Dr. Wallace, who is with a great partner of the farm program with Zoetis, and we're really going to be discussing and diving in to antibiotics today. So keep those questions in mind and feel free to type them in as we go about our conversation. But to kick us off, Dr. Wallace, would you mind giving us a brief introduction of yourself?
Yeah, sure. Thank you, Beverly. Well, I guess I think of myself as a grandfather, father, and a husband first, and maybe a veterinarian second. Might have been a little bit different earlier in my career when I was first out running around trying to earn a living. But now I consider myself a family man first, and really think about that when I think about how I, work, particularly around antibiotics. I started my veterinary career in private practice in Ohio and Wisconsin, and then I spent about 17 years in academia, mostly at the University of Illinois. I was the dairy extension veterinarian, and the focus of my extension program was really around helping Illinois dairy producers manage antibiotic use on their farms and avoid volatile milk residues. In 2010, I joined what was Pfizer Animal Health at the time, which is now Zoetis, and I currently serve as a director of cattle technical services. I have the privilege of working with an outstanding group of 12 dairy veterinarians and 1 dairy geneticist covering the entire United States.
Thanks. And Dr. Wallace is also a member of our Antibiotic Stewardship Task Force, and they, of course, is the group of folks that provide input into developing resources such as the Drug Residue Manual that we release on an annual basis and other resources pertinent to the judicious antibiotic use space. So to kick us off, Dr. Wallace, just starting at the very basics, what is an antibiotic and how do they work in our world?
Yeah, I think the first thing we need to understand is antibiotics only work against bacteria. So viruses and organisms like protothecas, they'll not be affected by antibiotic administration. Mycoplasmas, they tend to be a little bit different. Some antibiotics work against them and some don't. But antibiotics, in one way or another, they damage the bacterial cell, preventing them from replicating and creating more bacteria. Because the bacteria themselves secrete toxins that damage the tissues. And then severe disease happens when the immune system can't keep up with that bacterial load that's in the tissues. Antibiotics don't really cure disease per se by themselves. The body's immune system takes care of that. But antibiotic administration helps shut down that bacterial growth and replication long enough for the immune system to catch up to it.
Now, there's a lot of talk, in the media or communications or consumers have questions about, and maybe we hear a lot of buzzwords around the use of antibiotics and the overlap of use of antibiotics between humans and animals. So can you maybe speak a little bit to how they're similar, how they're different, what the interaction is there?
Yeah, okay. So actually, there's not a lot of differences between antibiotics used in animals and humans. Some of the original antibiotics that were used in livestock, such as sulfas and penicillins and even the tetracyclines, they were all used in humans before we started using them in animals. Today, we've got some newer antibiotics that are only available for use in animals. There still are antibiotics, though, like ampicillin and tetracyclines that are used in both humans and animals. So we often have to be careful about that. Typically, we look at the antibiotics as classes based on how they impact the bacteria. And so there is a class of antibiotics called beta-lactams, which is the penicillins and the cephalosporins, which is the majority of the antibiotics that we use in cattle, and particularly dairy cattle. And those inhibit the bacterial cell wall from forming. And that's how it sort of damages the bacteria and prevents it from growing. Then there's other classes of antibiotics like the quinolones and sulfas that actually work against the DNA of the bacteria. And while the macrolides and aminoglycosides and the phenocols and the tetracyclines, they all inhibit the protein synthesis of a bacteria. So that obviously damages the way the bacteria grow. So while a specific antibiotic may only be used in animals, there may be a very close cousin that is in the same class of antibiotics that may be only used in humans.
Okay. And, speaking of this overlap and things like that, how have we seen the trends in antibiotic use in dairy maybe change because of that, or what would be other drivers of change, and how have we made changes within the dairy industry around antibiotic use?
Yeah, I've had a pretty interesting, varied career. There's absolutely been some changes in my almost 40 years now of being a veterinarian. When I started practice in the mid 80s, we did what we thought was best for the animals in our care, and really without considering the downstream effects of those treatments on the food supply or in the environment. And there was really no malintent in our approach. We simply didn't consider how antibiotics may impact those downstream customers down the road. So we've learned a lot in the last 3 to 4 decades. Years ago, compounding or self-mixing of drugs used to be a real common practice. Then pharmaceutical companies responded by introducing more effective antibiotics for use in livestock. And that allowed us to sort of reduce the perceived need to compound or mix our own products. We could use products that were right off the shelf from these manufacturers. In addition, there were a lot of regulatory changes that prohibited some of these antiquated practices from being used in veterinary clinics. We've seen the bulk tank milk screening test switch from the less sensitive, the old Bacillus sterothermobolus disc assay, to a more accurate test, the CHARM assays. And so some of the regulatory testing process has improved. In 2017, the FDA introduced the Veterinary Feed Directive, which is a process that includes veterinarians now in the decision to use medicated feeds in livestock, particularly for the treatment and control of infectious diseases. So, before that, veterinarians were really not involved with that decision on whether a farm uses an MFA or not. And now, because of the Veterinary Feed Directive, the veterinarian has to be directly involved with that decision process. For many years, and even the 15 years that I taught at the University of Illinois, we really practiced and tried to implement preventive medicine programs. Really, the idea being that we could reduce the incidence of bacterial diseases that need antibiotic use. So, part of the whole goal is let's find ways not to have to use antibiotics because we have healthier cattle. And then more recently, genomic testing and selection of cows that are resistant to some of the common disease conditions like mastitis and metritis and even digital dermatitis or lameness, they're being used by progressive dairy operations now.
Yeah, and that ties into my next question. As the farm program and as promoters of dairy, we often hear that the dairy industry promotes and encourages the judicious use of antibiotics. Another buzzword or terms that we may use. So can you speak a little bit to exactly what that means and why it's so important for the judicious use of antibiotics?
Yeah, really judicious use starts with preventing animals from getting infected in the first place, as I said earlier. Selecting the best genetics for healthy cattle, managing the environment, proper nutrition, a good solid vaccination program. They all should be implemented by all farms, to start with. And then these practices obviously then reduce the number of animals that may need an antibiotic in the first place. Next, if an animal does get sick, we need to have some level of confidence that that diseased animal has a bacterial disease that will benefit from an antibiotic therapy. A good case in point would be, say, prototheca mastitis or even mycoplasma mastitis. We don't have any effective treatments for those mastitis cases. And so throwing antibiotics at those types of diseases really is not judicious use. So having a good way to have a case definition, and really the herd veterinarian can help develop those protocols to help make proper case decisions and aid in the selection process of appropriate treatments for those conditions. Once we pull the trigger to decide to use an antibiotic to treat an animal, we need to follow the label for the route of administration, the dose, based on the weight of the animal, the daily frequency, the duration based on the condition being treated, and especially the milk and meat withdrawal times. We know that underdosing or shortening that duration of treatment can lead to ineffective cures and then relapses, which means that we're going to have to use extra antibiotics to, finally cure that animal, which is obviously not judicious use. Overdosing or off-label routes of administration can lead to volatile tissue residues, which is again something we don't want to have happen as well. I think the other thing we need to at least discuss a little bit is the extra label use of drugs or antibiotics in this case. And extra label use, now defined by the Animal Medicinal Drug Use Clarification Act, or AMDUCA, requires that all extra label use is done under the direction of a veterinary record on the farm. Then that veterinarian must follow those AMDUCA regulations. And one of the regulations requires that if you use a product or drug in extra label fashion, you have to extend the meat and milk withholding time, because we aren't sure what that extra label use would do to those tissue residues or those milk residues. So really, for antibiotics to remain effective, it's really imperative that producers follow the label, and that will help us achieve that judicious use of antibiotic goal that we're all striving for.
Yeah, and if you want to maybe expand a little bit on the producer role, maybe if a producer is looking to maybe review what's happening at their farm level, wants to take some steps into maybe a direction that's more responsible use, or at least review what's going on, what would you encourage them to do, or how to go about that?
I think first thing, they need to contact their herd veterinarian. Really, all antibiotic use should be supervised by a veterinarian. I think the consumer expects this. When you think about all human medicine, antibiotics are done under the prescription of a medical doctor. You just can't walk into the pharmacy and say, hey, I want a dose of antibiotics. You have to have a prescription from your doctor. So it's something that consumers expect from the beginning. And I think they have that same expectation of our dairies. So the first thing that producers should probably do is establish that valid veterinary-client-patient relationship with a local veterinary practice. And then it's important that we set expectations both ways. We need to have the producer to be able to say, this is what I expect of you as the veterinarian if you're going to be my VCPR veterinarian. And the veterinarian has to have an expectation that you're going to follow my recommendations, or we'll talk about them and discuss them and really work it out so that we have a good working relationship. I'll put a little shameless plug in here for the Food Armor program, because you can find some of this information. They have a really good process for creating that viable veterinary client-patient relationship where, you sit down and you kind of check the boxes and say, this is what I want as a producer, and this is what I need as a veterinarian if we're going to have this relationship and make it work. And I think that's the important thing, is sitting in a room and making sure that expectations are common in both ways. Then the producer needs to work with that veterinarian to create some treatment protocols for the common diseases and conditions that might require drug therapy. From there, once you have your protocols, you can then create a drug list that you can generate, and you can adequately inventory those approved drugs for use on the dairy. And you can keep track of, okay, do we have the right products in place? And are we using them appropriately based on the protocols that we've established? Then it's important to sit down and work with the veterinarian and the herd staff, whether those are the cow side personnel or whoever's treating the animals, to create standard operating procedures that allow the veterinarian and the owner to have confidence that those cow side personnel are going to treat the animals the way that they expect them to be treated and handle that as the way that they expect to be handled. And finally, it's important that we document and record all treatments, and that we allow for, because this will allow us to have proper oversight of whether those treatments are being effective, and then making sure that we aren't creating any possible drug residues down the road. So I think you go through all those steps, and it makes really for a good plan for the producer to be able to employ.
You mentioned Food Armor, which I know a lot of their resources are online. Are there any additional places that you would encourage farmers to check out if they're looking for, you mentioned templates and record keeping to find out information around the judicious use of antibiotics?
Yeah, I guess initially I would start with their herd veterinarian. And these veterinary professionals have the training and knowledge to guide the producer in the right direction. And then from there are several other online resources such as Food Armor. But I will mention that the milk and dairy beef residue prevention manual that's available on the farm website is just a tremendous resource. This manual is updated every year, and after review from a broad group of industry, dairy industry professionals, people, producers, veterinarians. So it's got a lot of eyes on it that help make sure that it's accurate and up to date, and really a valuable resource. So I think it's free to download and maintain as a resource on your farm. So I would recommend that as a good resource to have around.
Yeah, thanks for that. And I've had a few questions come in, and as a reminder, if you have questions you want to ask Dr. Wallace, please feel free to plug those in the chat or the comment section, and we will get to those. First one asks if you have any idea looking into the future of what's coming next in terms of research and development and new antibiotic use or different uses of antibiotics, any ideas in that realm?
I mentioned a little bit, and one of the things that excited me the most in the last, let's say, 10 years or so, and really in my career, has been the ability for us to genetically select for animals that are less likely to get disease. I mean, I think prevention, obviously we've talked about that is the goal. Cows are going to still get sick, just like people. I mean, you can't prevent every single disease that occurs. But certainly we can reduce the incidence of disease on farms, and doing that, really helps us reduce the need for antibiotics. I really don't foresee any, major breakthroughs on new antibiotics that are out there. There'll be a little bit twists and turns on some of the current antibiotics, but I really think the regulatory industry at this point in the United States is probably not going to see a whole lot more, development in the antibiotic space. So we're really moving into spaces where we can find ways to keep cattle healthy and prevent them from needing those antibiotics in the first place.
Yeah, and the next one is a question around prescription use of antibiotics. And so maybe if you want to, and where we're headed to everything being prescription only, is that coming? Maybe a little background there, if you know what that looks like as far as what percentage of antibiotics are currently only can be prescribed versus is there anything that's available over the counter, and what direction we're headed as far as with over the counter meds in the antibiotic category?
Yeah, there are a few antibiotics that are available over the counter, but that's coming to an end. Pretty much everything that's going to be used in an animal, every drug, is going to have to be under the prescription or the supervision of a veterinarian. So, the veterinary feed directive was kind of the first step in that direction. A lot of times those medicated feeds were being fed to cattle, through the feed mill, and really didn't have any veterinary oversight on administration. I'll be honest with you, the veterinary profession does not want to be the policeman in this process. We really want to be part of the solution. Some of this is being handed down to us as regulations. This is, but it is really in our purview as far as veterinarians, and hopefully in our training and our professional background to help guide dairy producers and livestock producers in the proper use of antibiotics. So, my perception is that we're going to see a little bit more constriction of the use of any antibiotics in a over-the-counter base, and you'll see most of those drugs then falling into a prescription base from veterinarians.
If a producer is having difficulties finding a veterinarian to build that relationship with, what advice would you give them to find a vet as a starting place?
Yeah, starting place I would do is contact your state veterinary medical organization. I'm guessing that every state VMA. So if you're in Oregon, Oregon Veterinary Medical Association.org, you could probably do kind of a search on it. Contact them, let them know where you're from. They have rosters of veterinarians, in their membership that they can help at least direct somebody to. The other place you could check with is American Association of Bovine Practitioners. I'm talking particularly dairy farmers in this case, or beef producers. I wouldn't be able to help, ABP wouldn't be able to help with, pork or poultry producers. But, if you're a dairy or a beef producer, the ABP, you could contact them, and they can certainly put you in contact with the district director for that region of the country, and then they can help you locate a veterinarian that might be able to help support your needs.
Yeah, I know we've had that exact scenario happen before when someone's reached out to the farm program looking for a veterinarian, maybe in a specific rural area, and we were able to connect with the ABP team to connect them with a local vet. And a question in the chat that came through just mentions that there have recently been a lot of drugs that are on back order. Can you share maybe some insights into why that may be, and maybe when you think that that will be recovered?
Well, I think if you look at all goods and services across the United States, we're seeing some supply chain challenges, and that has an impact certainly on animal products and animal drugs that we produce as a company, or that other pharmaceuticals produce, vaccines included. So much of this is, for lack of a better, I don't want to use it as an excuse, has to do with the impact that some of the shutdowns of the COVID pandemic has had on our entire commerce across the United States. Hopefully we're seeing some of these things ease up as we get a little bit further down the road here and we get back to normal again. So I guess keep in contact, do the best you can with what you have, and we'll continue to try and strive to provide the products and services that you all need as producers to keep your animals healthy.
And so another question that just came through, what are your thoughts on preventative treatments such as dry cow treatment? And do you have any insight into that or input on utilization of dry cow treatment?
I'm going to guess that this question really centers around the concept now of selective dry cow therapy. And, if we think about how dry cow therapy was initially instituted in the dairy industry, it had to do with the high prevalence of Staph aureus and strep ag as infectious or contagious mastitis on dairy farms. Over the years, we've been able to reduce the prevalence of those two pathogens, those sort of contagious pathogens, down to a very low level. I mean, less than 5% of the current, culture positive cases, when you look at, current surveys of mastitis cases, it's pretty low. And so we don't have as many cows drying off with Staph aureus strep ag. We see that in our cell counts on our farms. When you have, herds that have really low cell counts, we're talking in the 100,000 range, on very large dairies or even on small dairies, there may not be a need to dry cow treat every cow with an antibiotic. If there's no bacteria there, back to my initial comment, antibiotics work against bacteria. If there's no bacteria in the udder at the time of dry off, then there's probably no point or no need to treat that cow with an antibiotic therapy at dry off. We have found that using internal teat sealants are very effective at controlling the mastitis in the dry period, so that when she calves in, she doesn't have a new infection at calving. So I think it's really imperative that, number one, the farm has the right, let's just call it environmental metrics and right management metrics to be able to think about doing selective dry cow therapy. A dairy that's running 300 to 400,000 cell count, I would highly recommend that they think about complete dry cow therapy, unless they have a great way to know which cows do and don't have it. Cows that are down in that 100 to 150,000 cell count range on a bulk tank probably can consider it. Then it's important that we have a good criteria for selecting which cows are going to get dried off and which ones aren't with an antibiotic. And then we need to make sure that we're absolutely pristine about putting in that internal teat sealant if you're not going to include an antibiotic in the combination. So, we have had cases where people have just put the teat sealant in and just not paid attention to how they're doing it, and then infuse bacteria in the process with no antibiotic there. And then you have, sick or dead cows, and that's not a good situation either. And then the last thing is to make sure you monitor that process, just like we would do with anything. Make sure that you're finding the results that you expect. Are you getting healthy cows? Do the cows not have mastitis after calving? Those are all important metrics to be able to measure down the road to make sure that your selective dry cow therapy approach at dry off is not having a negative impact on the herd down the road.
Thanks. And I think we have time for one more question. We can squeeze one in before we hit our time limit. But maybe if you'll speak a little bit about residue issues and maybe the impacts, kind of connecting by the responsible use, what happens, what is a residue, and what happens whenever residue is found for meat or milk.
Yeah, well, they're kind of two different areas. I'm going to kind of go with the meat side of things for now, since the dairy industry does tend to have kind of that black eye about ourselves compared to the beef industry or even pork or other livestock industries as far as creating the majority of those meat residues or those tissue residues. And the great thing is those numbers have been dramatically decreasing over time here the last several years. So I think the message has got out on proper use, and it gets back to following the label and doing the right thing. If you do have a potential residue, you might get a letter from the packing plant that'll tell you that, hey, we think we found something in here. Obviously, if it gets confirmed that it was a volatile residue, then you're going to probably have a visit from the USDA on that one as well. So, it's important that you work with your herd veterinarian, establish those practices, good practices in the first place, establish an adequate withdrawal time for any use that you have of antibiotics, and just keep good records. If you have a good set of records and you do get an investigation, usually it goes very well because they can see that you're trying your best not to have a residue. But if you come in there and hide your records and really are obstinate about the approach, chances are you're going to have a tougher go of it. So records are your salvation in this case.
Well, thanks for that. Thanks for answering all those questions. And of course, thanks to Zoetis for their continued support of the farm program and input into our priority areas. Just a reminder to everyone that is listening in, our next quick conversation will be November 3rd. And we will be joined by Dr. Lily Edwards-Callaway of Colorado State University and Lacey Alexander of Cargill, where we will discuss a little bit about fitness to transport and the priorities there. So make sure you tune in for that. And as an additional reminder, these conversations are recorded and will be available to review on our website at a later date with a few additional resources. Hope everyone continues to stay safe and healthy and have a good rest of your day. Thanks, guys.